Good afternoon and welcome everyone. My name is Stephanie Ventura and I am the Director of Education with the Ontario Association of Residence Councils. It's my pleasure to be here with you as we host guests from the Ministry of Long-Term Care, who will be speaking to you about updates to the COVID-19 pandemic response measures for long-term care homes in Ontario. Gail Ramsden is on the panel this afternoon and will pose questions that were submitted during the registration for this webinar. Gail lives in a long-term care home in Ottawa, where she is a resident leader. In addition to her leadership role within her home, Gail is a director on OARC's board of directors, and she is the co-chair of OARC's resident advisory group, the Real Group. I'll turn it over now to you, Gail, for the land acknowledgement.
Sure, thank you, Steph. Okay, together, let us now pause as we acknowledge the Indigenous peoples of all the lands that we own today, from wherever we are virtually participating in today's meeting. Let us take a moment to acknowledge the importance of the land we each call home. We do this to affirm our commitment and responsibility to improving relationships between nations and to improving our own understanding of local Indigenous peoples and their cultures. We acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this nation home. Let us now join in a moment of reflection to acknowledge the harms and mistakes of the past and to consider how each of us, in our own way, can move forward in a spirit of reconciliation and collaboration. Thank you.
Thank you, Gail. Before I introduce our guest speakers, I ask that you take note of some housekeeping items that are up on your screen. During this webinar, the chat feature has been disabled, but we do invite you to pose questions in English or in French by using the question and answer feature. The question box will be open and we will be monitoring those questions. Slides are available in English and in French following this presentation, along with the recording of today's webinar. They'll be made available on OARC's website and also emailed out to all participants. And now, without further delay, please join me in welcoming Anne-Marie Carnielli from the Ministry of Long-Term Care. Welcome, Anne-Marie.
Thank you so much, Stephanie and Gail. Super happy to be here today along with my team. So thank you everyone for taking the time to join today's webinar to learn more about the updates to the COVID-19 response measures for long-term care homes. As Stephanie mentioned, my name is Anne-Marie Carnielli and I'm a manager in the Service System Planning and Operational Issues branch in the Operations Division of the Ministry of Long-Term Care. I'm joined today by other colleagues on my team across our division and with the Ministry of Health. Before we get started, I would like to first acknowledge the sacrifice you've all made to protect your own health and safety and the health and safety of those you live with and who work with you in your long-term care home. It's thanks to this collective commitment and sacrifice over the past few years that we're able to further wind down some of the measures that have been in place for quite some time. I want to thank all resident councils for being such valued partners in our shared goal of improving the quality of care and the quality of life of long-term care residents across the province. We look forward to hearing your perspectives today and have left lots of time at the end to listen and respond to your questions. So today's purpose, so why are we here? We're here to provide you with an overview of the Ministry of Long-Term Care's recent guidance changes, which hopefully you've had a chance to read. These changes will be provided to you by Erin Mannix on my team. This will be followed, as you know, by a question and answer period. And as Stephanie mentioned, following today's webinar, we intend to share the presentation material in English and French. Should you wish to follow along with today's presentation in French, we ask that you please email MLTC pandemic response at ontario.ca, and we will provide you with a copy of the presentation in French. Again, as Stephanie mentioned, for any questions in French, please put your questions in the Q&A function in Zoom, and we will work to respond to them as quickly as possible. The next slide, please. So context for today's discussion. So today's updates reflect the ministry's ongoing work with the Office of the Chief Medical Officer of Health to monitor the status of the pandemic. And we are now taking the next step in the phased approach to embedding COVID-19 response measures into routine operations, including new changes to masking, IPAC audit frequency, and isolation requirements. The Ministry of Health has also made updates to their case management guidance for staff, residents, and visitors who have COVID-19, which will be outlined for you shortly. These changes are to be implemented by June 30th, 2023. However, homes that were prepared to make these changes in advance of this date were welcome to implement changes as early as June 26, 2023. Long-term care homes should anticipate that some pandemic response measures may be reinstated if the province enters a high-risk period of respiratory virus transmission, such as during the fall respiratory virus season. This is something that we will continue to monitor, and of course, will communicate with homes and you if there are any changes. I will now pass it over to my colleague, Erin Mannix, who will provide you with an overview of the recent changes. Thank you.
Hi, everybody, and thank you for joining us today. So the first change that I'm going to bring your attention to is masking. And this change is for caregivers and visitors. Masks are now recommended, but no longer required for caregivers and visitors in all areas of the home. This means that caregivers and visitors may now join in for dining and sharing a meal or a beverage with their loved ones in communal areas. Next slide, please. For staff, students, volunteers, and support workers, masks are now required based on a point of care risk assessment, consistent with existing routine practices and on the return to work protocol following COVID-19 infection. So what this means is that the individual will assess the risk of exposing themselves or others to an infection and determine whether they should be wearing a mask in each situation. So also, staff may consider wearing a mask during direct prolonged care, and that is defined as one-on-one care within 2 meters of an individual for 15 minutes or longer. Also for staff, students, volunteers, and support workers, that piece that I mentioned, masks being required on the return to work protocol following COVID-19 infection, staff with COVID-19 are now able to return to work once their symptoms have been improving for 24 hours and they have no fever. Staff should follow measures to reduce the risk of transmission for 10 days from their symptom onset or positive test, which includes wearing a mask and distancing from others before they remove their mask to eat or drink. And lastly, masks are no longer required for staff, students, volunteers, and support workers in administrative and staff-only areas. So that means in lunchrooms, in offices, or in a staff gym if your facility has one of those. That being said, long-term care homes are encouraged to implement mask-friendly policies. So that would mean accommodating staff who prefer to continue to wear a mask beyond minimum requirements, and also residents or substitute decision makers who request that a staff member wear a mask when providing care in alignment with the resident's Bill of Rights. For residents with COVID-19, residents do remain under isolation and under additional precautions for 10 days. However, if a resident is able to independently and consistently wear a mask, residents may leave their room provided it has been 5 days from symptom onset and a positive test. Their symptoms have been improving for 24 hours and they remain masked at all times when outside of their room. If unable to mask, then the resident remains in isolation until day 10. Oh, slides are moving. Residents are able to leave their room for walks in the immediate area with a staff person wearing appropriate personal protective equipment, so a mask, to support their overall physical and mental well-being. For visitors and caregivers with COVID-19, non-essential visits to higher risk settings, which would be long-term care homes, or to individuals at higher risk of severe outcomes, so long-term care residents, should still be avoided. However, if a visitor is essential to a resident's overall health and well-being, such as a caregiver, they are able to visit within that 10-day time frame if their symptoms resolved, but they must follow additional precautions for 10 days, including wearing a mask. So, with that being said, what measures currently remain in place to protect and optimize the health and safety of those living and working in long-term care? So that piece about masking is still required based on a point of care risk assessment, and visitors and caregivers are recommended but not required to wear masks. There is still passive screening, which is the self-monitoring for symptoms, as well as daily symptom monitoring of residents to detect for the presence of infection. There is also routine infection prevention and control practices. For example, hand hygiene, environmental cleaning, ventilation, and lastly, the access and availability of COVID-19 vaccine and therapeutics for prevention and treatment of COVID-19. What COVID measures are no longer in effect? So these measures no longer apply, but it is really important to note that some of these measures may be needed again in the future if there is a high risk to resident and/or staff health and safety, if the context of the pandemic changes. So there is no universal masking, no physical distancing or cohorting, no visitor restrictions, no asymptomatic screen testing for staff and visitors, no active screening for residents and visitors, and no absence restrictions. And also note that these measures that are not in effect, this is in an instance when a home is not in outbreak. There may be changes to these based on guidance from the local public health unit if a home is in outbreak. So we're going to move over to the question and answer period now.
Thank you, Erin and Anne-Marie, for providing that information for us. We're going to dive right into the questions. There were quite a few that were submitted through the registration, so when you signed up for this webinar, and we are keeping an eye on the question and answer section of the Zoom platform here to see if this new information that you've received, if it was new to you, if you would have any questions related to the information that was presented. So I will hand it over to Gail to ask the first question.
Yes, thank you very much. The first question that I have is, what can I do if my home decides to keep mandatory masking in place?
So I will take that one, Gail. So these ministry requirements that I outlined in this presentation are the minimum that is required by long-term care homes. Homes do have the ability to implement their own masking policies or testing policies or any other policies that may go above the ministry's minimum. However, if a home does that, they should engage their residence council, family council, and the local public health unit to inform their policies and review their policies regularly to ensure that these policies are supported by the most current clinical advice and evidence. And they should also seek independent legal advice if they have concerns with making these policies.
Okay, thank you very much. The next question is, can you talk, I think you did cover this quickly in the presentation, but it's probably worth doing it again just to reinforce the answer. So the question that was posed is, Can you talk about the residents' right to ask their caregiver to wear a mask when they're working with them? Should I ask my caregiver directly? Can I put a sign on my door that I prefer that they wear a mask? Is there something that should go into my care plan? What would be the best method for me to make that point?
So that's something that the home will determine what their policy will be. So the ministry has provided the advice and the recommendations that homes should implement a mask-friendly policy, but that would be up to each home to determine what their policy would be surrounding that. So I would encourage each resident or substitute decision maker, power of attorney, to speak to the home about their policy surrounding that.
Perfect. Thank you very much. The next question is, will masks be reinstated again if there is an outbreak on my home area? And how would these changes be communicated to the residents?
So I can start with this one, and then if there's anything, Laura, you want to add. So in the event of a COVID-19 outbreak, homes must follow the direction of the local public health unit, including cohorting practices. So every home may have their own process for communicating these changes to residents, and residents are encouraged to follow up with their home on what that process is going to look like for communication. I suspect it would be the same as it has been throughout the pandemic, and how homes have been communicating to their residents on what these policies are. In terms of specific directions surrounding masking, my colleague Laura Sagan's on, and I'm gonna call on a friend and see if she has anything to add on that, or if it would just be from the local public health unit.
Yes, Erin, that is correct. Yeah, nothing to add from me.
Okay, Gail, you're doing great with all the questions that came in. It seems most of our questions, well, all of our questions, in fact, have come in through the registration. So if anyone is on right now and would like to pose a question in the question and answer box, please feel free to do so. In the meantime, we'll continue with the advanced submitted questions. Thanks, Gail.
Yes, sure, no problem. Thank you. The next question, pardon me, is kind of twofold. The first part of it is, am I able to share a meal with visitors, family and friends in the dining room? And the second part is, what can I do if my home prevents me from dining with a guest?
So as I mentioned, masks are no longer required for caregivers and visitors in all areas of the home, which means that caregivers and visitors are able to share a room, share a meal with their loved one in the communal dining area. However, as I had also mentioned, homes are able to have their own policies that go above and beyond. So I would encourage you to speak to your home about that policy and work towards a solution for a way to make that happen, whether that be a room or a designated space if your home does not allow it in the communal dining area.
Great, thank you very much. The next question is, the current visiting hours in my home are very restrictive. When can long-term care homes go back to pre-COVID visiting hours?
So at this time, there are no ministry restrictions on visiting hours. So, and also as set out in the regulation, homes are not able to restrict caregivers from essential visits and restrict the length or frequency of visits for caregivers in long-term care homes. So in terms of that, if after consultation with your home on this policy and these parameters, there are still restrictions and unable, you can contact us at MLTC Pandemic Response, that email that's on the screen, and we can connect with you and the home on that one.
Okay, thank you. The next question is, if there is another wave of COVID-19, will my family be prevented from visiting again?
So at this time, there are no ministry plans to reintroduce stricter measures, though that may come based on the context of the pandemic, but those decisions are made in consultation with the Office of the Chief Medical Officer of Health. And as set in regulation, as I had mentioned, there is no restriction to essential caregivers from entering a long-term care home in the length or frequency of visits to long-term care homes. That is in regulation, that they cannot be restricted.
And Erin, if I can just ask a follow-up to that one, you can just confirm for us that that includes if the home is an outbreak, and if it is not, if I am a person who has an active COVID-19 infection, I can still receive visits from my essential caregiver.
Yep, that's correct.
Okay, thank you so much for that. Gail, I think we'll give you a little bit of a breathing break. There are some questions that have come in through the question and answer pod here. And the first one is, so lots of questions about masking actually. And this first one is about dietary aids specifically. Are they required to wear masks?
So masking is based on that point of care risk assessment. So that would be up to each individual to make that point of care risk assessment. And if the individual performing or does not have the skills or not perform a point of care risk assessment, then a supervising healthcare worker or a supervising healthcare worker at the home can do that assessment for them. Homes can also establish a protocol of signage, perhaps, of what that would look like and what requirements need to be met to for individuals to wear a mask. So for a dietary aid, I can't specifically say yes or no, because that would be based on that point of care risk assessment in their day-to-day tasks.
Thank you. Thanks for that. And the next question is also about masks. And this one asks if a person wishes, can they wear a cloth mask? And so it doesn't distinguish between if this person is a caregiver who is providing care or if it's a resident or a family visitor. So cloth masks, any comments on those?
So I'm going to pass this one to Laura Sagan with the Ministry of Health.
Thank you so much, Erin. And hi, everyone. Sorry, I don't think I turned my camera on yet, but I'm Laura. I'm with the Ministry of Health. I'm a policy and program advisor. And in our Ministry of Health guidance, we don't actually recommend wearing a cloth mask or include that as an option. We do suggest wearing a well-fitted medical mask. So those are the standard kind of blue or white ear loop masks that you'll see most people wearing. We recommend this for visitors, caregivers, and residents who are isolating who are COVID positive.
Thank you, Laura. Okay, Gail, we'll go back over to you.
Great, thank you. The next question that I have has to do with boosters. And the question reads, can residents receive booster doses this summer if it's been 6 months since their last dose? Or should we wait for fall boosters? Or are there any more boosters? What is the status on boosters?
And I'll take that one, Gail. I'm Rena Bowen, a Senior Policy Advisor with the Service System Planning and Operational Issues Branch here with the Ministry of Long-Term Care. So it is anticipated, or we're expecting, that there will be a fall booster campaign for residents this fall with the 6-month interval since their last vaccine dose or confirmed COVID-19 infection. So we're waiting at this point in time from public health to have a confirmation that we are going to have a fall booster. We are also saying that have a discussion with your attending physician or your medical advisor as to if you are eligible now, meaning that it's been 6 months since your last booster or since your last COVID infection, as to what would be reasonable for you in anticipation that there will be a fall booster. And we're hoping to hear something within the next couple of weeks.
Very good. Thank you, Rena. My next question has to do with preparedness. We were unprepared in 2020 to respond to the virulence of COVID-19. Are we now preparing stores in various communities of PPE, vaccines, et cetera, in readiness for another similar event?
So I think again, Gail, I could probably take that one. So long-term care homes have access to free PPE, and we have encouraged long-term care homes to use the government portal. So for instance, if family members or visitors are coming into the long-term care home, they should be able to access a medical mask. You know, when they go into a long-term care home, because again, it's free. I mean, as far as vaccines are concerned, we haven't had any issues with not having a healthy supply of vaccines. So a healthy supply of vaccines and a healthy supply of PPE shouldn't be an issue come any kind of surge that we might have.
That's great. Thank you. My next question, excuse me, has to do with some of the items in the long-term care home that were stripped away during the height of COVID. Things like books from the library, salt and pepper shakers on the table, games and puzzles and the like. So I don't know whether the latest guidance talks to when those things are allowed to be brought back.
I can talk about that, everyone. Hi, everyone. Jackie Sweetnam here. I'm a manager in the operations division. Thank you very much. It's very, very nice to be here. That's a really good question, and we're really aware of that issue. And I understand it's a sensitive issue. And as I say all this, I'm really afraid that I might not be able to give you a really good answer. We're concerned. We're aware of a lot of those. What we heard, the experiences that we heard about. We heard about one experience of a resident in a home, for example, having her knitting taken away during COVID. And, you know, maybe this is a whole other conversation we could have on another day, but I think some of that may have been a little overzealous and a bit of a kind of over-interpretation of what to do from an infection prevention and control perspective. But what I wanted to say is that, you know, the current guidance from our ministry, and including the IPAC standard, doesn't really talk about, you know, removing salt and pepper shakers. It doesn't get down to that level of detail. It's really about, and one of the things I wanted to mention, just sort of in terms of the context of some of these issues and other questions that people are asking, you know, the ministry has done quite a bit of work with a lot of the licensees to support them to get someone into the IPAC lead role, to develop the knowledge and competency of the person in that role. And there will be instances where, you know, it's really up to the leadership and the IPAC lead in that home to make decisions about the level of risk in that home. So there could be instances where masks are brought back in an individual home because of the circumstances in that home. Anyway, but related to this issue, we don't talk specifically about, you know, taking people's knitting away. It's really about the IPAC lead and the leadership in the home exercising good judgment and making decisions that are about the real circumstances in the home and what makes sense from an infection prevention and control perspective. And if you as a resident are concerned that, you know, that the Scrabble game has been taken away, or as a caregiver, or your mom's knitting has been taken away, I really would encourage you to raise that issue, because it may be a little bit of overzealousness or, you know, over caution that really is not appropriate, and there's really no need to take someone's knitting away. So I apologize for talking so long. I just think this is such a good question, and I apologize for my long-winded response, but I hope it's somewhat helpful. Thank you.
I think the answer that you provided, though, Jackie, is on point to speak to the overzealousness of IPAC and what the residents' ability to challenge that overzealousness is, because it's, you know, in the long run, it's the residents that are suffering the results of of an IPAC team who might be erring more strongly in caution, towards caution where it's no longer required. So what are the residents' rights in that situation?
Thank you. And I apologize. I understand my sound is not that great, so I apologize for that. I'll try to fix that here.
Thank you, Jackie, and thanks, Gail. I do have a question that's come in through the question and answer. And this one is asking if you could please explain again the restrictions covering caregivers, so team members who have COVID-19, and I guess even family caregivers. Is there an initial 5-day period when the caregiver is prohibited from visiting a long-term care home? And I guess that applies for staffing as well. So is there that initial period where the team member can't come into work?
Hi, Stephanie. I can take this one. So
you.
it's Laura from the Ministry of Health again. So in our guidance, we specify, so both for staff and for visitors, we say that if you are a case, if you are a case of COVID, so you have tested positive for COVID or you have COVID-like symptoms, to self-isolate at home until your symptoms have been improving for 24 hours and you don't have a fever. We also recommend that if you're trying to visit somebody in a long-term care home or a setting such as a long-term care home, that you try to avoid that visit for 10 days. However, if you are providing an essential visit, so like a caregiver, you are able to come in within those 10 days, provided that your symptoms are improving for 24 hours. And we ask that the caregiver wear a mask and take a little bit of extra precaution just to try to make sure that the person they're visiting doesn't also get sick. So for example, to wear a mask, to try to physical distance as much as possible, and to notify, if you're comfortable, to notify the setting as well that you have recently tested positive, so that the setting and the staff can also take extra precautions if they see fit. And if the person that the visitor or the caregiver is visiting can also wear a mask, that would be great as well.
Thank you, Laura. Okay, Gail, do you have any other questions on your list?
I do. I have 2 left, and they're both in the same vein. So I'll take them one at a time. The first one is, what would it take for the restrictions that are now lifted to be reinstated locally or provincially?
I think that might be a question for me. So I work closely with the Chief Medical Officer of Health, and we are having those types of conversations about what that would look like. We do recognize that right now we're in a period of kind of, I won't say low risk, but non-high risk is the term that we're using. So we do recognize that things are a bit more relaxed right now. And of course, during the respiratory season, we might start seeing more outbreaks and more cases and more severe cases. So we still don't know quite what the threshold will be or what kind of numbers we're looking at, but those conversations are happening internally.
So if we were to find ourselves in that situation again, the communication of that new guidance would follow the same process we've been using?
That I'm not completely sure about now. I won't speak to that because I'm not sure. In previous years and pre-pandemic years, that communication looked something like a letter, that was sent out to everyone instead of a guidance update. So right now, I'm not 100% sure on what that would look like, unfortunately.
Okay, fair enough. Thanks, Laura. The last or the second half of that, and sort of in wrapping up my section of the Q&A anyway, I thought it might be good to maybe go back to that slide that talked about what are the only COVID-19 restrictions that are left in place. What are we still facing? that has not yet been completely eradicated. There we go.
So I can speak to this one. At this point in the pandemic, we're looking at the lessons we have learned throughout the pandemic and what measures will need to remain in place going forward. So that means optimizing and prioritizing resident and staff health and well-being in long-term care homes. So looking at lessons learned and experiences of infection prevention and control practices in different ways that we could really heighten and minimize the risk of transmission of any form of illness in long-term care homes has been a really important lesson learned. So something like passive screening is something that is a simple and easy measure that will now be embedded in routine practices, as it is self-monitoring for symptoms to look at preventing infection from entering the home. So there are pieces, I would say, that won't ever for sure go away because they are positive lessons that we have learned throughout the pandemic. I don't know, Jackie or Anita, if there's anything to add from that, but.
Sorry, I apologize if my sound is still poor. I was just gonna say, I don't think I have anything to add. I think, as others have said, unfortunately, it's a bit difficult to predict, but thank you.
Thanks, Gail.
No, thank you very much. And that wraps up my section. I'm out of questions.
Okay, well, just in time, because we have a few that have come through the question and answer as well. But before we get to those, I wonder if it would be possible just to give us a little bit of an explanation about what goes into that point of care risk assessment. So we've talked about it a few times during this presentation, and if you could just give us some information, what information do team members use when performing that point of care risk assessment?
Yeah, so I can speak to a little bit at the beginning, and then if I miss anything, Laura, feel free to tack on to the end. So a point of care risk assessment, also called a PCRA, is part of routine practices. So healthcare workers are expected to be familiar with this process. In some circumstances and settings, as I kind of mentioned before, this could be achieved by the patient room signage indicating the level of precautions needed as determined by the infection and prevention and control lead at the setting. So there could be parameters set that if you are going to be in front of the individual for X amount of time, or specific parameters or indicators for that staff member to follow. But that would be worked out with their IPAC lead. And IPAC practices are something that the ministry does inspect at every inspection. So that's kind of like a beginning piece on the PCRA. Laura, I'm not sure if you have anything else to add on that.
No, that was perfect, Erin. Thank you.
Thanks, Erin. We do still have some questions in the question and answer about sharing meals. So this is something that people really missed the last 3 years, is just having that ability to share a meal with a family member or a friend or someone that's important to you. So the question is, can I share a meal with my resident in their own room?
Yep, so this change actually was accommodated at the initial phase of winding down masking, in which caregivers and visitors could visit with their loved one without a mask when inside the resident's room with no one else in the room, no staff or other residents present, or in a designated area for those residents who have roommates. There are no ministry restrictions or measures surrounding an inability for a loved one to share a meal with their resident, a caregiver, or a visitor. So this is something that homes should make every attempt to accommodate and facilitate this to happen.
Thanks, Erin. And so the update this time was allowing for family members or friends to share a meal in common areas. We were just talking before the webinar started that prior to COVID, you used to be able to, buy a meal ticket and have barbecue outside with your family member, with your resident, or even sometimes in a special section in the dining room, you could share a meal. If it was a birthday, you might be there to sing happy birthday and have a piece of cake with your family member. So looking forward to having some of those special moments brought back and available for people who might have moved in during the pandemic and don't know what that experience was like. Okay, and there are a few questions about recreation. So recreation and activities are a big part of people's lives. And my background is in recreation as well. So even before COVID, some of these things were brought up as reasons why activities could not take place in the home. And, you know, IPAC measures existed before COVID as well, and were taken into consideration during recreational programs. So this specific question is about baking, a baking program that's held in the home. Are residents who do group baking allowed to share what they've baked with others? I can sort of give you a little bit of information about this before we turn it over to our experts from the ministry. But even before COVID, you know, you had to use those food handler safety measures and make sure that you could ensure people were doing their hand hygiene prior to working with any of the baking materials. Of course, if it was something that was not going to be baked and you were just preparing, say, a salad or something, extra precautions needed to be taken because the things weren't going to be cooked. And so lots of different considerations for a baking program. In my experience, it looks different from home to home with how things are run. And it really is a starting point is a conversation with between yourself and the IPAC lead, the lead of recreation, and the residents to discuss, you know, what can be done, what's safe to be done, what everyone's comfortable with. But that's my experiential learning, but I can hand it over to any of our ministry colleagues if you'd like to add.
Yeah. Also near and dear to my heart, I am a recreation therapist, and that's where I came from, working in homes and long-term care homes doing recreation. So definitely can appreciate the benefit and the fun experiences that these activities bring to residents in homes. So you kind of did answer that pretty well, Stephanie. It does look different from home to home in terms of that. And also bringing back kind of what I mentioned earlier about those IPAC lessons learned during the pandemic. So each home may have different applications of what they learned and different policies surrounding what they choose to implement going forward. But I would say that definitely residents can speak to their recreation lead or activation lead or program manager, depending on what it's called at each home, and also speak to the infection prevention and control lead, who could reach out to their local IPAC hub if they have questions on how these policies could be implemented and what ways they could move forward to best enable activities to happen in the ways that they had prior to COVID, and if there are things that they need to adapt to facilitate this in creating their policies. So I can't answer a specific question about sharing food across the home, because that would be a unique policy with the home, but I would encourage you to speak with both your recreation lead and your infection prevention and control lead on that.
Thanks, Erin, and thanks also for mentioning to reach out to the IPAC hub. In addition to reaching out to those outside sources, it's always great to contact another home. If you have a relationship with another team at another long-term care home, or perhaps your home is part of a group of from the same operator, you know, call them, ask how they're doing things, what's working for them, and share some of those learnings across the board. And you can help use those examples to enrich your decision making. Okay, another recreation related question. This one is about animals in the home. So not really specific to COVID, but just IPAC in general is, you know, having animals in the home.
Yeah, so we have had this question before. I'm not sure about the specifics of it, but there is no requirement in the regulation against or for animals. There's also no COVID specific requirement. So to me, this seems like a home specific requirement on permitting the animals within the home. So again, I would say take that one back to the leadership at your home to discuss the policy surrounding that.
Perfect. Thanks, Erin. Another question about booster vaccines. So should homes continue to book booster shots?
Yes, and I just actually wrote a response, Stephanie. So as I mentioned before, we are anticipating that we are going to have a fall booster campaign. However, residents who are eligible now, so they're 6 months since their last booster or since their last COVID infection, have a discussion with your primary caregiver, so your attending physician, to find out what's best for you. Should you have a booster now, or should you have a booster come fall? So it's really on an individual basis. So have that conversation for sure.
Perfect. Thank you, Rena. This question is from a resident. If I test positive, I'm positive for COVID, I would imagine, but I'm symptom-free, do I still need to be isolated in my room for days? And maybe we can mention how many days.
Thank you, Stephanie. I think this one I can answer. So it's a bit tricky because we're currently not recommending that anybody who isn't symptomatic, so doesn't have any symptoms, gets a test. So all things being equal, a positive test, only having a positive rapid test and having zero symptoms whatsoever would not require self-isolation. If there are other variables, such as obviously an outbreak scenario or a close contact situation where the person might have come into close contact with somebody who is COVID positive and symptomatic, then of course it might be a different scenario. The person would then have to self-isolate for 5 days, assuming they're still they still don't develop symptoms after 5 days. Then they can obviously not self-isolate anymore after the 5 days. But in general, somebody who's just doing a rapid antigen test for the fun of it, with no other variables that test positive, would not need to self-isolate. No.
Okay, thank you. And then just a question about the length of time for symptoms to resolve. So we can come back into the home and visit once symptoms are resolving for how long is it, or improving?
So sorry, let me just look at the questions. Is this Bernadette's question?
Yes.
Okay, perfect. So yes, so we are saying that anybody with symptoms should stay home and isolate for a minimum of 24 hours. So they should wait until symptoms are improving for 24 hours. And if they're a general visitor, they don't need to visit a resident in their home. We're asking them to stay home for 10 days. If their visit is essential to the residents' mental health and well-being, we're trying to get some flexibility by saying that they're able to come in and visit the resident, provided that it's been 24 hours that they're feeling better. So their symptoms are improving, they're on the mend, and they don't have a fever.
Thank you. Thanks for that. And our very last question. So thank you everyone for participating and for being here through the question period. The last question we have is, if a resident tests positive through a rapid antigen test, should they still receive a confirmatory PCR test?
This one might be from me as well. So we're not asking for a confirmatory PCR test in the Ministry of Health guidance. Of course, if it is a situation where an outbreak might be suspected or a confirmed outbreak, that would be up to the public health unit and the outbreak management team of the home.
Okay, thank you so much. All right, well, we've been together for just under an hour, and we're reaching the end of our time together today. Our sincere thank you to the team from the ministry. You've been so great at answering all the questions and sharing this valuable information with us. And also to Gail for taking us through all of the pre-submitted questions. I'd also like to thank the audience for your thoughtful questions, for your participation, for your time. Please take a moment to fill out the short survey that will appear on your screen when you exit this Zoom webinar. Your feedback will help us to improve, and it also encourages us to continue with what is working well. I wish you all a pleasant evening, and thank you so much.